Happy Sunday. Come on in. Hey, Facebook. Welcome, Instagram. All right, welcome. Happy Sunday, self-love, self-care Sunday. Y'all know how we do. Got to take care of ourselves, not every day, but we have our certain days where we focus mainly on self-love, self-care. Okay, so let's get today started. Come on in if you have any questions, any concerns, anything that's on your mind. Feel free to speak your mind, and we can go over today how organs affect us Lupus. Okay, today, of course, lupus is a complex and challenging disease that us Lupus deal with on an everyday basis, but dealing with systemic lupus that involves the organ system in the body, which is affected by either lupus or lupus medications. Now, the organs that I wanted to focus on today is the central nervous system, brain, spinal cord, eyes, mouth, skin, heart, and lungs, kidney, digestive, reproductive system, and the blood system. A lot of people I contact and speak with have questions on what organs are affected. So basically, just to start off, the brain and spinal cord. I myself do not deal with the central nervous system when it comes to being affected with this organ, but people are affected, and when you are affected, symptoms that you might have is confusion, brain fog, seizures, challenges in personality, or stroke. Now, lupus impacting the peripheral nervous system, sorry if I'm mispronouncing that, correct me if I am, may cause neuropathy, damage to the nerves, which could cause numbness and tingling. Now, I have not been diagnosed myself with the central nervous system, but I do have brain fog sometimes, of course confusion. It's not severe, but it is days where you have like brain farts. Also, if you do have any of those symptoms, please contact your rheumatologist. Let them know. Ask questions. Do not hesitate, because not one of us, again, are the same. So if you do not bring your rheumatologist awareness to what is going on with you and you alone, then they cannot help you to the best of their abilities. Now, CNS lupus is extremely challenging for doctors because there are many other things that may cause issue with the brain or the spinal cord. Due to the complexity of central nervous system lupus, a number of tests may be ordered to determine more specific information. A CT scan, an MRI may be used to examine the anatomy of the brain, for example. The treatment of CNS lupus varies depending on the symptoms experienced by the patient. Again, if you have symptoms, concerns, questions, do not hesitate to contact your rheumatologist. Now, also eyes are affected. Come on in. If you have any questions, don't hesitate. Also, eyes are affected. Now, it is important, of course, to go to an eye doctor at least once a month to 6 months. I myself recommend every 6 months because people don't realize that steroids, prednisone, can cause issues with the eyes. An elevation in eye pressure, which is a major risk factor for developing glaucoma. So it is important. Also, people don't realize that there are prednisone tests that you should have done by your eye doctor on a regular basis. I didn't know that. I just actually found that out recently. Now, the mouth is also affected. Up to 45% of lupus experience mouth sores. One of the most common lupus symptoms, oral health complications for people who have lupus, can include red or white sores, usually painless, on lips, gums, and roof of the mouth. Dry mouth. I experience dry mouth a lot. Believe it or not, tooth decay, mouth sores, and oral fungal infections are among the issues people with lupus may face. Diseases associated with lupus can cause these oral symptoms, and the side effects of lupus medication can appear in the oral cavity as well. Had no idea. So make sure you go see your dentist every 6 months. Gotta have that white smile. Also, skin. We had a discussion on this a couple weeks ago, how the sun and artificial lighting can cause skin problems, whether it's rashes, mylar rashes, butterfly rashes. Patients may experience rashes anywhere on the body, such as the face, the chest, even on your arms. Now, it is important to determine if rashes are due to lupus or due to something else, like fungus or bacterial infection. Depending on the nature of the rash, the patients may be sent to a dermatologist or have a skin biopsy. Treatment for rashes include topical creams, lotions, or ointments. Now, in order to prevent myself from having rashes, I use sunscreen 100+. I also have oils that I use that I had put together. That includes tea tree, vitamin E, mineral oil, coconut oil, and some other oils that I mix together. I also put my 100+, I melt that down, and I put it inside my oil, and I use that on a regular basis. I use it on my hair, skin, and nails. Love it. And it does wonders. Also, what is affected is the heart and lungs. It is important to understand the way the heart works in order to discuss how lupus may cause issues with the heart. So, excuse me, but I'm going to read this because I want to break it down and give you word for word. Sorry, y'all. Give you word for word of exactly how they broke this down. So basically, deoxygenated blood enters the heart through the superior vena cava and is pumped into the right atrium, then through a valve called the tricuspid valve and into the right ventricle. From there, the blood moves through the pulmonary valve into the pulmonary artery and is pumped into the lungs. In the lungs, the blood is filled with oxygen and deposited back into the heart through the pulmonary vein and into the left atrium. The now oxygenated blood moves from the left atrium through a valve called the mitral valve into the left ventricle. From the left ventricle, the oxygenated blood is pumped out of the heart through the aortic valve into the aorta and on to the rest of the body. The walls of the heart are made up of muscle. In some patients with lupus, there may be inflammation and weakening of the heart muscle, which can result in less effective pumping of the heart, called cardiomyopathy. If I'm mispronouncing anything, again, please don't hesitate to correct me. I'm doing the best I can. Now, patients with lupus can also experience problems with the heart valves. The valves may not open and close properly. Sometimes clumps of vegetations will develop on the valves that may be from lupus or may be caused by an infection not directly related to lupus. Another common impact of lupus is called pericarditis. I suffer from this, which I break it down to pleurisy, which is an irritation and inflammation of the sac lining of the heart. Or excuse me, no, that's totally different. Pericarditis and pleurisy is two different things. So excuse me. Pericarditis, which is an irritation and inflammation of the sac lining of the heart, or pericardium. Patients with pericarditis may experience chest pain that may worsen when they lie on their back. Patients may also experience a pericardial effusion, which is a buildup of fluid in the pericardium. Cirrhosis, pleurisy, inflammation and lining around the lungs. That is what affects me. The inflammation of the lining around the heart that causes chest pain, which is a worse than deep breathing, is the pericarditis. Now, it's very similar because the lining around my lungs is what the pleurisy is. And that's what affects, and it has similar pain. Lay on my back, I get sharp pains shooting from my back to the front or front to back. It's hard to breathe, it's hard to catch your breath, and it's a difficult process. It really is. It's very painful. It takes anywhere between a couple days to maybe a week or two for it to go away, and it eases up. I do breathing exercises when it affects me, and I focus on trying to not eat anything that causes heartburn or anything like that, because I noticed that it makes it more severe. The test used to look for cardiomyopathy, valve disease, or pericarditis would be an EKG, an echocardiogram, an ultrasound of the heart. Treatments for cardiomyopathy may include steroids or other lupus medications. Those with valve disease may need blood thinners or antibiotics for treatment. Treatment for pericarditis and pericardial effusion may include anti-inflammatories or in more severe pericardial effusion. They may need to be treated with steroids or have the fluid drained. Other lupus medications such as Imuran, Cellcept, or Benlysta can also be used for treatment of these conditions. All right, now kidneys. One of the issues that I have is frequent urination when it comes to my kidneys. I also notice how sometimes my kidneys swell up and my urination basically stops. I might urinate maybe 1 or 2 times. I know TMI, but it's part of it. 1 or 2 times a day. And you can tell the difference, how it affects your organs. Now, one of the jobs of the kidneys is to clean the blood by filtering it and producing urine, which then drains into the bladder and it is finally expelled. Lupus nephritis develops when certain cells and inflammation invade portions of the kidney, causing difficulties in releasing urine and therefore producing swelling in areas of the body such as the face, hands, legs, and feet due to water retention. I also take water pills because without it, I have a lot of swelling. So, FYI, water pills are your best friend. This is often worse in the morning. Additionally, patients may experience high blood pressure, blood urine, pink or brown, protein in the urine, foamy urine, or bubbles in the toilet, fatigue, weight gain due to excess fluid, or decreased urination. There are 5 or 6 different types of nephritis. Doctors base their diagnosis of lupus nephritis on the patient's symptoms, an elevation of blood tests and urinalysis, and often a kidney biopsy. A blood test includes looking at creatinine levels. We'll call them CL. If CLs are high, it indicates that the kidneys are not functioning correctly. A urinalysis is used to look for protein and blood cells in the urine, as well as the protein ratio. A kidney biopsy is used to determine the type of nephritis a patient has. Treatment for lupus nephritis often involves the use of steroids by mouth and or IV. Patients who are extremely ill are generally given cytoxin or Celsep. Celsep is used with a lot of things when it comes to the organs. In the past, doctors frequently prescribe Imuran. However, mycophenolate or Celsep is currently more common. Blood pressure medication called ACE inhibitors such as lisinopril or enalapril. And remember, with any medication for blood pressure that has pril at the end, it has shell, which is a seafood. So if you're allergic to seafood or shell food, please make your doctor aware of that, because anything that ends with pril, majority, and that's because my father used to take that. So he had an allergic reaction because they didn't know he had allergic reactions to shellfish. So when he took the lisinopril, he blew up and cut off his circulation, or his breathing. But are often given to control blood pressure, as well as help the kidneys keep proteins in the body and prevent them from spilling into the urine. Now, the digestive system, your digestive system moves food through the body, taking nutrients in and getting rid of the waste. This process starts at the mouth and goes through the intestines. Lupus and some medications used to manage symptoms can cause side effects in the digestive system. Inflammation in your esophagus caused by lupus can trigger heartburn. I get severe heartburn. Ugh. I do take medication for that too. Digestive problems are common in lupus. The symptoms you may experience include nausea, vomiting, diarrhea, and constipation. I have experienced all the above. My digestive system is jacked up. Drugs you take for lupus, such as non-steroidal anti-inflammatory drugs, and corticosteroids are often the cause. And that is a fact. Reproductive system is affected as well. Now, they say lupus doesn't directly affect your reproductive organs, but the disease can cause complication during pregnancy. I'm 40 years old. I know I'm careful. I know I have been really careful all my life, but I'm 40 years old and I do not have children yet. Now, my question is or should I say, are my reproductive organs actually affected? I know it's probably harder for you to conceive, excuse me, from what I have read. I know that your ovaries and your uterus can be affected. So my question is, can lupus directly affect your reproductive organs? And I would like to actually look into that further. We'll have another discussion on that later. But anywho, a pregnancy with lupus is considered high risk as is and requires more frequent doctor's visits for monitoring. Risk includes miscarriage, premature delivery, and preeclampsia. It's also possible for a baby to be born with neonatal lupus syndrome, a condition that affects the heartbeat and causes a rash. However, a woman with lupus most often gives birth to a healthy baby, thank God, and I hope every single one of you do. She may just need additional care from the doctor during the pregnancy. Now, the blood system. Here's another one that we need to break down. Because I actually had to break it down for myself because I wanted to fully understand. And that's what they say. To fully understand the impact of lupus on the blood, it is important to know the different type of blood cells and their roles. White blood cells produce antibodies, help fight infections, and promote healing. Red blood cells deliver oxygen throughout the body, and platelets help blood to clot. Lupus in the blood can lead to a number of issues that impact all three different types of blood cells. Each lupus patient is different in the way that lupus affects their blood cells. Some may have low blood cell counts across the board, and others may have low blood cell counts of one or two specific types of blood cells. Low white blood cell counts may increase the risk for infection. Low platelet counts may increase the risk of bleeding. When red blood cell counts are low, it is called anemia. Gotta love it. People with chronic disease who consistently experience inflammation throughout the body may be more at risk for a type of anemia called anemia of chronic disease. Something I suffer from. Gotta love it. I mean, it's a struggle. There is also an increased risk of anemia in those with kidney disease, in which I have kidney issues. So another cause of anemia is hemolysis, where the red blood cell count decreases due to a red blood cells popping and dying. Some symptoms of anemia may include fatigue, lightheadedness, and more. Have had all of it. A blood test is used to determine if lupus is impacting the blood. In rare instances, a patient may require a bone marrow biopsy. In some cases, there may be no action taken in terms of treatment. Other treatments include steroids or other lupus medications such as Celsep and Imuran. Now, there are other organs that are affected, but those are the main organs that are affected. If you have questions, concerns, please don't hesitate to contact your rheumatologist or even your general practitioner. These are some of the issues that I suffer from, so I feel like other luppies might be able to, question or share their input. So please don't hesitate to question, give your insight, experience you have suffered from. I would love to bring anybody in to speak with one-on-one so other luppies can see how other people have flare-ups and what they experience on a daily basis. Now, cutting this short, we do have one more sale. Cyber Monday sale. So any orders over $100 receive a free LED mask. This is what they look like. And it does have material on the inside, so it is comfy. It does come with a filter, so you can put the filter right here. Lights up, 7 different colors. You have red, green, blue, yellow, like a turquoisey light blue, pink and purple, white. Flashes several different colors. And it's awesome. It's one of our best sellers. Definitely during Halloween. Holidays are coming along, so you can have your face mask match your red outfit or your green outfit. Okay? You know we have to be fashionable as boss babes. And this is unisex, so that will come free with orders over 100. Thanks everybody for Black Friday, Small Business Saturday sales. Everything was actually beyond my expectations. I appreciate it. Next discussion, we're going to get a little bit in my business, okay? We're going to speak on dating with lupus. So, I'm in a dating game. I have had many relationships. I really was not focused on relationships for a while because I was in school. I wanted to focus on school and then start getting into the dating scene, quote unquote. But now I'm finishing up school, so I'm getting ready to get back into the dating game. Again, I am 40 years old. I try not to look too 40-ish, you know. Still got a little youth to me, okay? But 40 years old, no kids, so we're going to get back into the dating scene, and I would like to keep documentation on how that goes and see how other people are dealing with the dating scene having lupus. I have noticed so far, I've been on Facebook dating. Somebody told me to check it out, so I did. I do put out there I have lupus. I also put out there that I wear wigs because of my discoid lupus. So I haven't had too much negative feedback, but I have had a few guys just like ghost me, you know. I haven't heard back from them. So I'm not taking it to heart because it is what it is. It is who I am. It doesn't define me, but it is part of me. So if they cannot accept who I am, then I feel push on, honey. So we're going to start next discussion on dating with lupus. See how that goes. Let me know your thoughts and your insights on that. Please like, follow, share. I do not own the rights to the music you're hearing currently in the background. Follow us, subscribe to YouTube. I am on YouTube as well. We repost these videos on YouTube. Please, I appreciate all the help and all the likes and shares and comments. I thank you for you guys tuning in today. We usually keep this no more than 30 minutes, so I appreciate all of you. I really do. And see you next Sunday. Self-love, self-care, take care of yourself. It's a must. And again, thank you again for tuning in. See you next Sunday. Dating with lupus. See how it goes. I'm interested. So far, so good though. There's some cuties out there. Wig cleanings. See y'all tomorrow with some wig cleanings, honey. Tuesday. We're closed tomorrow. Wig by Boss Babe Wig Cleaners. All natural, realistic wigs. Get you some wigs, honey. I'm going to take care of you. You can also come by and put hands on so you can see what you're getting before you purchase. Y'all have a great Sunday. Love y'all.